One baby in 750 is born with clubfoot, but in South Africa the incidence is higher, closer to 1 in 500. One or both feet are twisted inward and point down, making it difficult for a child to walk if they haven't been treated. When Cape Town resident Karen Moss's son was born with club feet in 2003, she began searching for ways to correct his condition.
I realized that he was heading towards surgery, and I decided to do a little bit more investigation about what other options there were for his treatment. And that was how I found Dr. Ponsetti, who at the time was 89 years old, working at the University of Iowa Children's Hospital, and he had been developing this method and perfecting it over 50 years, and he had case histories of patients that had incredible results.
The Ponsetti method involves a gentle manipulation of foot and ankle, as well as a series of plaster casts. About 80% of children also need a small procedure to cut the heel tendon, but that is the extent of the surgery.
If you can get a child within the first few weeks of life, by the time they're 3 months old, the casting process will be finished. And then they go into wearing the clubfoot brace, which is 2 little shoes attached to a bar in a very specific position. And that child will sleep in that brace nighttime and naps literally until the age of 4. And what that brace does is it stops the feet from turning in again.
Seeing the positive results that were achieved with her own son convinced Karen that Africans needed to know more about this method. In 2005, she started an NGO called STEPS, with the hope of helping children born with clubfoot in southern and East Africa. STEP's goal is to give every child born with clubfoot access to the Ponsetti method.
The Ponsetti method is ideal for low resource settings. Not only is it over 95% successful when done by trained people, but the majority of the treatment can be done by a physiotherapist, an occupational therapist, an orthopedic nurse. Anyone that has been trained and understands anatomy can practically do the Ponsetti method. And obviously it also will be releasing theatre time for other cases. And then you also don't have the risk of anesthesia, which can cause problems as well, and especially in newborns.
STEPS arranges these training sessions so that the treatment can be further reaching. This is crucial, particularly in rural areas where people don't have access to many doctors. The Ponsetti method is now widely used in South Africa.
It is best practice. It's been endorsed by the Pediatric Orthopedic Society in South Africa, and it's taught in the medical schools, and it's really here to stay. It's grounded, and it's in South Africa and in neighbouring countries. We were actually one of the fastest to take it on, so I'm really proud about that.
Through STEPS, over 300 medical staff have been trained, 21 clinics supported, and over 9,000 children have received treatment in the Ponsetti method. It has spread the word to Namibia, Botswana, Seychelles and Tanzania, and provided support to patients and their families to make sure that a child born with clubfoot has a chance to lead a normal, active life, a life without disability. Isley Jacobson for VOA, Cape Town.